Hey everyone, I'd like to welcome you all back to this segment of From the Hip. This is Dr. Shelley Plumb. I'll tell you what, I was drinking my morning coffee this morning and I staggered across an incredible article. It was about plastic surgery, and can you guess how many people in the United States in 2016 had plastic surgery? I'll tell you what, it was 1.8 million people. That number really astounded me. And you know what? I wanted to set out and find out more about plastic surgery, what we need to keep in mind if we're going to embark on that journey to have plastic surgery done. So we here at PlumbTalk found an excellent specialist. We found Dr. Dabbah. Now, Dr. Dabbah, for those of you not familiar, is a plastic surgeon that is in Boca Raton, Florida, and he has been practicing for about 20 years. He is really a wealth of knowledge. So in a moment, we will be back with Dr. Dabbah, and we will find out more about what we need to consider if we're considering having plastic surgery. Well, hey everyone, we are back and I am here with Dr. Dabbah. How are you, Dr. Dabbah?
I'm great. How are you?
I am good. Okay, so I must know, this wonderful brand that you have created, Ageless Attitude, what is that exactly?
Ageless Attitude is trying to look and feel on the outside as you do on the inside.
That's really very important, and you are a very well-known plastic surgeon in Boca and have been practicing for 20 years, I understand.
Correct.
And how important is it to feel good on the inside as well as the outside, in your opinion?
In my opinion, it's much more important to feel good on the inside.
Yes.
If you feel good on the inside, that's going to come out
right.
and express itself on the outside, and people will see that.
It's interesting because as we were discussing, I have a medical background as well, and I'm always curious when I meet another surgeon is, how did you get into medicine? Tell me.
No one in my family was a physician or in the medical field at all.
Okay.
And so I realized at a very early age that I was always interested in anything that was related to medicine on the television, in newspaper articles, and I would just be attracted to that.
Right.
And understand it, and then want to know more about it. And that's how my interest in medicine developed.
So you started out in medical school. And medical school is a journey, is it not? I mean, you're kind of finding your way. And how did you find your way into plastic surgery?
I knew even when I went into medical school that I wanted to be a surgeon. That was very important to me. If I couldn't be a surgeon, I really did not want to be a physician.
Right.
And I had a unique opportunity at a very young age to actually see a live operation when I was 9. And at that point I decided I wanted to be a surgeon, but I didn't know what kind of surgeon I wanted to be. And I didn't really decide that until I started my general surgery residency, where you're exposed to every single subspecialty of surgery you can imagine. So you're doing orthopedic surgery, urology, delivering babies. And I got exposed to a plastic surgical procedure, and I realized I understand this.
Right.
I don't even have to see it twice.
It was almost like second nature to you, am I right?
It does.
Yes?
It does. I think the profession draws you in that direction,
right.
and you find where your comfort level is.
That's interesting. That's interesting. So getting into the plastic surgery field, you know, it has to be fascinating, first of all, and it's changing. Is it changing for the better, in your opinion?
What's interesting about plastic surgery is it tends to go in cycles or circles. You know, we start off with what I learned 20 years ago in residency, and then you see all these changes that occur.
Right.
New technology, new approaches, and then you realize almost everything comes back full cycle to where
Yes.
it was before.
Right.
And you learn that the fundamentals of plastic surgery are the most important aspect of practicing plastic surgery.
That's interesting. Now, it's interesting because I have done research on you, and you have an excellent reputation
Thank
for,
you.
for practicing those fundamentals and that ethics there. So, in your opinion, is there things that people out there who are watching this that they need to, there's two things that I find that people are looking for. First of all, they're looking for a surgeon that's competent, which you are. They're also looking for somebody who's kind and compassionate, really cares about them. So back to the competence issue. Are there things that people out there should be looking for in a surgeon?
Absolutely. I think that you need to do your research. You need to ask your physicians. If you
Yes.
have an internist, an obstetrician, gynecologist, try to get some names. And once you
Okay.
get a few names,
Right.
these days it's very easy to Google and look up someone's credentials.
Yes.
It's very easy to access the sites of the American Board of Plastic Surgery and make sure that your surgeon is board certified by the American Board of Plastic Surgery, because I think what's most confusing to people and patients when they're researching their physicians
Yes.
is that any doctor can call themselves a cosmetic surgeon.
Is that right? Now
Correct.
that's something that I didn't know, and I had questions because I've seen doctors I have known that I didn't know they were cosmetic. So go on.
You could be any type of physician, call yourself a cosmetic surgeon, and you can perform cosmetic surgery and cosmetic procedures without any formal training.
Okay.
And so there are these boards that are really not recognized by the American Board of Medical Specialties.
Okay, that's
which
important.
is what our viewers really need to understand, is that just because someone says they're board certified does not mean that it's a recognized board,
Yes.
nor does it mean that they're board certified by the American Board of Plastic Surgery.
May I ask your certifications? I've seen a bunch of letters after your name, so for our viewers.
Yeah, my most important certification is the American Board of Plastic Surgery.
Okay.
That's really the only board that recognizes the plastic surgery field.
Yes.
There are other boards that recognize just limited facial plastic surgery.
Sure.
But as a board certified plastic surgeon, we are board certified to operate anywhere on the body.
That's interesting. Okay, so the competence issue we talked about. How about how important is that kindness and that compassion component of practicing? I know my viewpoint because my patients, a lot of them that came, that were regular, that came back to me, it was because of the kindness. They knew that people cared, and you have a reputation, honestly, in the community for caring. How important is that?
It's very important. I actually enjoy interacting with my patients.
Good, yes.
and learning about them as much as I do operating on them. So I take an interest in my patients. I find it fascinating to find out what profession they were in, what they did, where they went to school, where they grew up. Sort of like what we're doing here. You're trying to find out a little more about me. I enjoy finding out about my patients because it creates that rapport and that interaction that makes their experience with me so much better.
Oh, it has to. It has to, right? I mean, and jumping off of that, I know that you give back to the community in many respects. Am I right? What are you involved in?
I'm involved with a lot of different organizations, but recently, a few years ago, I did get involved with the George Snow Scholarship, which provides financial help to the high schoolers in our community
Right.
who want to be able to go to college but don't have the financial means. So I had a wonderful opportunity to actually dance
Dance.
in
Okay.
front of
Now, this is
750
interesting.
people,
Uh-huh.
sort of like the TV show Dancing with the Stars.
That's excellent. Okay, so we have to talk about that. Okay, Dancing with the Stars.
Yeah.
Yes,
Yeah, so obviously the main goal of all this is to raise money.
absolutely.
So we use this opportunity to ask people we know and companies that we know to support me
Right.
in this venture. And you take lessons with a professional dancer.
That's incredible. Right?
You take time out of your day to do that. And over the course of time, you learn a routine. It's about a 2.5-minute routine.
Okay.
And in preparation for that, you are also given a costume to wear, you have to get spray tanned.
Is that right?
Which is very interesting. So you have to look the part, you have to act the part.
Right.
You're there to make those 750 people that are watching you, you have to make them feel entertained and that they're doing it for a good cause. And it was one of the most memorable experiences I've ever had. And we were able to raise quite a bit of money for the foundation. So we were very happy to do that, and it's something that will always be special to me.
Right, yes, the dancing.
Yeah.
You took me by surprise. I didn't know about the dancing. That is really incredible. Okay, so we're going to have you back one day and you're going to dance for us. So we'll have a lot of fun. So I must know a little bit about your brand that you've been developing, and I'd love for you to share with our viewers just a little bit more about Ageless Attitude. First of all, how did you and why did you come up with that name?
We wanted to sort of identify ourselves with what we really feel, and
Yes.
attitude is something that people express from within.
Yes, very true. I love that. Yes.
Right. So the ageless part is more of the outside appearance.
Mm-hmm. Sure.
The attitude is from the inside. So if you can combine your positive attitude with your ageless appearance,
Yes.
it sort of builds the core of who you are.
Yes.
And so when we see patients that come into the office, I hope they have that wonderful attitude.
Right.
And then I can help them with the ageless part. And then once I do that, you've got that ageless attitude already combined.
And let's circle back, because I want to link that to the feeling good on the inside, because it does link, doesn't it? The ageless attitude, I like what you said, because there's a play. You can help them on the outside, but really that beauty and that wonder from the inside, that attitude has to come from them. So you're a team with your patient, am I wrong?
We are a team, and we do spend a lot of time talking to patients. That's where talking to patients is very important, because we're sort of psychologists at the same time.
Right,
we're
sure.
trying to figure out, why are you here?
Yes.
Why are you willing to go through a procedure or a surgical procedure electively? And is this the right procedure for you? So I have to determine if this patient is the right candidate. Are they going to be able to handle the surgery? And is it really going to have a positive effect on them when we are done?
That's true. You set them up for success from the very beginning.
Right. And there are, people are surprised to find out that we do turn patients away.
Right.
If
Yes.
they're in for the wrong reasons, or the operation is just not the right procedure for them, we won't perform that operation or that procedure.
While you're talking, that particular comment, one word pops to my mind, and that's honesty. You're honest with them. You're up front. You want to set the expectations from the very beginning.
You have to be honest. Also, there is so much out there these days that is very confusing.
True.
For consumers,
Yes.
for patients. There's a lot of new technology. There's a lot of new research going on.
Right.
And sometimes you get caught up in all of that, and
Yes.
you actually end up going to the physician and saying, this is what I want.
Yes.
Before you really find out, is that the right thing for you, they're fixated on getting a particular procedure or a particular surgery.
I was doing some research on plastic surgery before you and I spoke, and there was, I think it's the American Society of Plastic Surgery, and they were citing that in 2016 there were over 1.8 million plastic surgical procedures done in the United States alone. That astounded me. And hearing you speak, I wonder how many of them were researched so comprehensively as you do with Ageless Attitude. What do you think? I mean, it seems to be increasing too. What are the trends?
There's definitely an increase in the number of plastic surgery procedures or cosmetic procedures that are being done. And that's usually inclusive of all the non-invasive, what we call non-invasive or minimally invasive procedures.
Okay.
For example, the injectables that we do.
Okay.
The neurotoxins such as Botox that we inject.
Right.
So the number of those procedures has increased tremendously, adding to the overall number of surgical procedures that we do.
Oh, I see. Okay. That's interesting. Well, Dr. Dabbah, we're going to take this opportunity to take a short break, and in a moment we will be right back. Defense is a green antimicrobial product. It is approved by the U.S. Environmental Protection Agency and comparable regulatory bodies around the world. It wipes out 99.99% of harmful germs and viruses with its non-stop active protection. The process for application is easy, fast, and safe. For more information, email info@microgermdefense.com or call 1-855-282-3338. Oh my goodness, a wealth of knowledge. Dr. Dabbah, thank you so much for being here with us. Now, viewers out there, I'm sure with 1.8 million people out there looking into plastic surgery, what words of advice would you give people who are considering doing a procedure?
Sure. I think that with the internet these days, a lot of the patients that are coming to see me have done a lot of research on the internet. And my advice to them is there is accurate information, yes, and there is inaccurate information.
Okay.
So it's very important to get your information from reputable websites,
okay,
and do some research. Do some research into what you are interested in getting.
Yes.
And then also do research into the physicians that you are going to be seeing for consultation. So make sure they're board certified in the specialty that you are interested in. In this case, the American Board of Plastic Surgery. These days with reviews online, it gives you some idea of who you may be seeing. You can look up their education online. These are things that we didn't have, 20 years ago.
No, we
but
didn't.
Now it's so accessible. And then once you do that research,
yes,
I would select, 2 to 3, maybe plastic surgeons,
yes,
that are reputable, and have a consultation with 2 or 3 plastic surgeons.
I would imagine that's key.
I think it is
Yes.
key. I think that if you're, I have some patients that only come and see me, and that's wonderful, but it's always nice to get different perspectives and get to know your surgeon, because I tell patients that it's not just performing the operation. Who is going to be taking care of you after the operation?
That is important, because I was very picky when I was doing surgery. I would do the surgery and I was the one that would follow up, but I do know of people where that person, somebody else would take care of them afterwards. And in your opinion, that is important.
I just had a patient yesterday tell me that she couldn't believe that I was the one that was taking out her stitches and that I didn't hand her off to somebody else to do that. And in my opinion, her surgery is not complete until I take care of those things for her.
Yes. I like you already. I think that is fabulous, fabulous. So for viewers out there that have watched this amazing interview and want to know more about Dr. Dabbah, where would you point them?
Sure. I'll point them to Googling Dr. Dabbah. Our website is drdabbah.com with a DR, and then my last name, D-A-B-B-A-H. They can certainly access that and get information. They can contact my office, 561-488-1700, if they're interested in coming in for a consultation.
Perfect, perfect. Well, on behalf of the entire PlumbTalk team, I'd like to thank you so much for joining us today.
Thank you so much.
Oh my goodness, I think we'll all agree that Dr. Dabbah is a wealth of knowledge and a very, very kind man. I think what I took away from this interview is actually a couple things. Number one, if we're going to embark on plastic surgery, we really owe it to ourselves to do our research. Make sure that we have the right doctor. Make sure that we know what we want out of the procedure itself. And also to make sure that we're safe. Really a wealth of knowledge he was. So until next time, this is Dr. Shelley Plumb. This has been another segment of From the Hip. We'll see you soon.